Welcome to a new episode of Mind Your Mind, the podcast dedicated to all frontline workers around the world, hoping that you do take steps to take care of yourself, but also we want to encourage organizations to keep an eye on the well-being of all their staff. So here we are to encourage you, to support you, to give you ideas. And today is a very, very special episode because we are part of the third edition of Podcasthon. This is an event that is highlighting a charity of our interest, and I will tell you about the charity that we have invited today. And basically, we want to encourage you as well to support them and to donate to their amazing cause. You will know a little bit more about them. They are the Human Values in Healthcare Forum. And today I am with Paquita de Zulueta. She worked since 1984 in the inner city of London. She's a retired GP, has worked with volunteering for Doctors of the World. She was the lead for the NHS outreach team following the Grenfell fire. She is a senior honorary lecturer at Imperial College here in London since 2000. And she, alongside other people, set up the charity called Human Values in Healthcare Forum, which aims in collaboration with others to rehumanize healthcare and prevent dehumanization. So let's give a big welcome to Paquita. Thank you so much for being here with me and joining me in this very special episode as well.
Thank you so much, Roxana. I'm honored to be here. And yes, so let's start our conversation.
Do you want to tell me about the Human Values in Healthcare Forum?
Yes, I'll just give a little bit the story and what our key aims are. You gave our mission, which is to rehumanize or humanize healthcare and prevent dehumanization. Mm-hmm. So it actually was set up in the 1980s by a group of doctors, distinguished doctors, one of whom wrote about inequalities in health, called the Black Report, and a social scientist. And actually what galvanized them was the recognition that the profession can become corrupted by the existing political scene. And this was really after they read the Nazi doctors. And how on earth did a profession which should have moral codes become so corrupted? And then they branched out into looking more at advocacy for the marginalized, the vulnerable who can't access healthcare. So that included prisoners, asylum seekers. And they also looked at developments in medicine and technology in the healthcare context that could had ethical and social implications. So then it was actually hosted by Gresham College, which is a very distinguished college, but then they lost that, and then I sort of took it up and became the chair, and had some conferences I arranged at Imperial College. And then, to be honest, I was so busy as a practitioner and a parent that I couldn't sustain it. But now I've retired from general practice. I thought, let's reignite it and make it now for the 21st century, really looking at the issues that concern us now and make it a charity. And we have four broad aims, which I've kind of mentioned, but one is the awareness raising of systems and practices that develop and support compassionate, person-centered care and resilient communities and what undermines them. The other A is activities. We offer educational resources and events, which we try to make free or by donation only, and we collaborate with others that also promote human values in health and social care. I should say the values that we care about are compassion, wisdom, integrity, and justice. And we feel they're absolutely pivotal in the health and social care, and actually just for humanity's future, really. We also, as I mentioned, give advocacy, giving voice to people who can't access healthcare, who are discriminated, or just don't have means for healthy living. And then we, as I said, we appraise and look at ethical and social impact of advances in science. But a lot of our work is actually supporting the healthcare workforce. And we organize replenishing events. And more recently, we've just started a program called Reflethics. And that is offering the opportunity for people from all disciplines in healthcare to come together in a safe, respectful space and to talk about the moral issues and challenges that they encounter in their work. And through dialogue and talking through, it's facilitated by somebody like myself who has experience in medical ethics, and somebody who has and a co-facilitation with somebody who is, very experienced in running groups. So a bit like Balint groups, if you've heard of them, but a bit different and a bit like Schwartz rounds, which I can talk about, but really looking at more at the ethical complexity. And that has been found that these conversations, these facilitated conversations, help people to be more morally resilient and to prevent or reduce the risk of moral distress and moral injury. So it has a benefit in that way. We've just received some funding for that, so we're very happy. So we feel we can really get going on this program. Yeah,
that's fantastic news. Congratulations for that, because that's the very, there are so many things that you have just said. First of all, for me to say that the values of the organization are really aligned with Mind Your Mind values as well.
Yes,
and I was so pleased to find you, to have the conversation at Felicity's de Zulueta book launch.
Yes.
So we want to send her love as well and congratulate her for her book, but also to realize that you were there and that the Podcasthon was coming up, and that we will have the opportunity to talk about this and highlight all the amazing things that you're doing. Do you want to tell us a little bit about the Schwartz rounds and the plans that you have to continue developing the groups?
Yes. At the Schwartz rounds is something. I'm a Schwartz round facilitator for the Imperial Trust and for now more for the medical school. And they are, you ask, what is successful projects, and the Schwartz round is a successful project. It's structured meetings. They're quite structured, and where healthcare professionals can talk about, share their stories of the emotional and social impact of their work. And you can invite, anyone can come from the trust. And then, so they present their story. They're again facilitated. And then in a short, they don't take long. And then we invite the audience to see how it resonated with their experiences. And, and it only lasts 1 hour. And then the panel, as it's called, with the 2 or 3 people from the team who were talking, can give their final words. And then we wrap it up, and that's it. There's often a free lunch provided. It's Jill Mabon did an NIHR full evaluation, mixed method evaluation study, and it's shown to improve staff well-being, more collegiality. People understand what the others are doing. They realize that they have common issues, and it's also improves patient outcomes to a certain extent. So it's really a successful thing. It's now spread to, I think it's over 250 trusts, and including hospices, other care homes we're trying to get actually, but not so much. But so quite a lot of mental health units and so on are using this system. And it was brought over actually from the US. And Kenneth Schwartz was himself a patient, and he had a very long and traumatic cancer journey. And he realized what a difference it made, just those small acts of kindness, that human to human contact from the staff. And then he thought, well, who supports them? They have to carry this enormous emotional load. And so he set up this foundation, and it's now the Schwartz-Round Center in America, and they're disseminating it, if you like. So that's the Schwartz-Rounds.
Yeah, and so interesting because it gives the space, that safe space for everybody, in the trust to be able to share what they are going through. And because one of the things that we know that is remarkable in developing probably burnout as well is the isolation, the shame and the isolation that sometimes is experienced with the difficulties around not only the emotional load that the workers have, but also all the morally difficult decisions sometimes they have to face. Do you want to tell us? I'm very curious, and I would like to bring clarification about the concept of moral injury. Would you like to explain us a little bit about that?
Well, I'll just say just a final thing about Schwartz-Rounds, which is so important. It's very democratizing. So it dissolves hierarchies because every voice counts. And so even what a hospital porter says or a junior doctor or nurse, their voice is just as valid as that of the senior consultant or the CEO. And I think also for the younger ones to see a consultant actually having tears about, they realize it's okay to feel sad. And so it has that benefit as well. It allows for the emotions. So, getting to, which is linked to this, getting to moral distress and then moral injury. But moral distress really arose in the nursing literature. It was Jamerton who coined the term. And it was, in a nutshell, it's when you know what you feel is the right thing to do for your patient and you can't do it because of some constraint, usually an organizational constraint, lack of time, lack of facilities, or maybe even someone higher up in the hierarchy preventing you from doing what you think is the right thing, the compassionate, patient-centered thing to do. And it's kind of expanded a bit more in that it can be actually when you don't know what the right thing is to do, a kind of perplexity.
Yes.
And if you have several of these moral incidents, let's call them, it can kind of become moral injury when you really are. And that is a much more profound and how should one say, profound change, if you like, in that people feel their whole moral compass has been shaken. They feel bewildered. They may experience a lot of shame, which you mentioned, isolation. And then it can lead to, of course, psychological sequelae, such as depression, suicidal intent, PTSD. But it's important not to psychologize it because really it's to do with the values of that person being dissonant with the values of the organization. And there's a lot of evidence that if you have value congruence, you have happy staff. If you have incongruence, the reverse happens. You get disengagement, burnout, people wanting to leave, and so on. So that's really it's a lot in the nursing literature, huge amount, but it is now more in other domains such as medicine and so on. There's a recognition of how important it is.
Yes, definitely a recognition, and probably it has been highlighted as well as a consequence of the pandemic, maybe.
I was going to say that the pandemic really created a lot of moral distress because, for example, not allowing the relatives to be with their dying loved ones.
Yeah.
It's very painful. And the nurses were more at the coalface, really. And so that was very difficult. And also sort of triage decisions they felt weren't fair. There were many, and issues of justice come in, actually. And injustice. So
and that was a very particular moment in history, really, a very, very special and incredible circumstances. But in day to day,
Yeah.
in the day-to-day kind of decisions that people have to make in their jobs. And we also can look at the structure of the organizations and what, as you were saying, the values of the organizations and how that actually definitely can impact on how people are experiencing work. And because this is making me think about, so many we enter this profession with a desire of helping or being useful for society and so on. So it's a very strong moral compass there in terms of giving and being part of solutions more than problems, right?
Exactly. Yes. Yeah.
So this also is making me think about compassion.
Yes.
And not only compassion from the professional towards the patient, but also self-compassion, and probably the compassion that is experienced within the Schwartz groups, for example.
Yes.
So can you tell us a little bit about your understanding of compassion and self-compassion within the context of self-care for the staff?
Yes, absolutely. I mean, I'll give a definition by Paul Gilbert, who is the professor of psychology and the founder of the Compassionate Mind Foundation, which I think is a good one. He describes it as a sensitivity to the suffering of self and others, and also that comes from the Dalai Lama, with a deep commitment to try to alleviate and prevent it. So it has many components. It's a complex entity. It's not just an emotion. So there has to be, of course, the awareness. You have to be aware that somebody's suffering. And if you're very busy and time, time is of the essence and you're rushing, and I have several examples of this, then you may not even be aware. So you need that awareness, which can, if you have a mindfulness practice, I think can help. And then you have to imagine what it's like for this person. They sometimes say putting yourself in their shoes, but they're different though. So it's recognizing that their shoes are different from your shoes. But, so there's that, it's called perspective taking or cognitive empathy. And then there can also be that automatic affective empathy, which is when your mirror neurons you feel that distress yourself. But then very important is being able to make space for this distress. So what they call distress tolerance, because otherwise you start thinking only about yourself and you try and cut off and shut off from that suffering. You just don't want to know about it. So that's not helpful. And Paul Gilbert really emphasizes this, there's a motivation. There's a motivation to relieve suffering. So it takes you into action. But again, it requires thinking through carefully what would be the right thing for this person, maybe responding to what they say or how they behave, so that you can do an intelligent, wise response to the suffering, not a sort of rushing there and, rescue, and which may not be what's required. So there's lots of components to it. And I've mentioned wisdom and also courage. People think it's soft. No, it's sometimes you have to be courageous to be compassionate. So we've seen examples of that. So that would be my understanding of compassion. And then again, just getting back to the self, unless you have self-compassion, then it's difficult to sustain that compassion for others, really. And self-compassion was again defined by Christine Neff.
Yes.
Who's a psychologist, and she has these three elements to it. She said that common humanity, that we recognize that we're all vulnerable, we're all fallible, and, we're not alone. So you mentioned isolation. And then that self-kindness. So being your own best friend, befriending yourself, not beating yourself up, not being overly self-critical, which I have to say, healthcare professionals, certainly
it's
doctors
very common,
who I coach and have provided therapy for, they are very self-critical, very highly perfectionistic, very unrelenting standards, unforgiving. And of course, at some point they crash, you can't sustain that. So self-kindness, which is not about being indulgent. It's okay, I made a mistake, but I'm going to do better next time. So it's able to pick yourself up. And then she brings in mindfulness, which I think in her case is more about, again, that sense of awareness and being able to recognize the emotions that you're feeling and being able to give space for them and tolerate them. So there's the three elements. And I see compassion not as a thing, but as a flow. It's about connection and reciprocity. So it flows in and out and between. If that makes sense?
Absolutely. It makes me think about the need of attunement as well, that need of connecting with someone and sort of understand. We are making assumptions about what others may need at any given time, but also there is the very concrete needs, but also sometimes there is so much desire, and I see it a lot in all the supervisees that I work with and people that are starting in their careers, that they struggle with this notion of wanting to help, and in that desire of wanting to help, the rescuers come out, and that need that, and then your help is less helpful. The more you want to help, the less helpful you become. That's why it's something to practice. It's something for me. Compassion and self-compassion is about practice as well, of understanding your own rush, because we are human, right? And we want to do something, but your own rush in going into help, but at the same time listening, understanding what's going on for the other, and then act, because sometimes we just need to be silent next to someone, and that's all what is needed.
So that idea of presencing, and listening is very important. And you mentioned attunement's absolutely, key. And, the Gilbert and others have developed it from evolutionary psychology and also attachment theory. So it's recognizing that we are social creatures. We have developed we are finely attuned to the emotions of others. And we've developed this in our system. But unfortunately, and we can get onto that if you like, there are situations which can actually reduce or undermine the compassionate impulse, if you like, that compassion motivation.
Yeah, and if we think about a healthcare professional, for example, that is highly, working in a very high intensity kind of work, with shifts, with personal lives, with difficulties at home, and having to deal with so much at work as well, naturally is expected that sometimes they start to become numb. And that numbness will stop them from actually be connected with the other at a more human level. And with oneself too.
Yeah, so with the self, and this was very important during the pandemic, and that's where role modeling can help, is that with the self-compassion comes self-care practices, having regular self-care practices. And so we can, talk more about that if you like.
Yes, and we definitely can, because before we go probably to that encouragement of the personal self-care practices, I'm also thinking about what is the role in the leadership, because you are talking about a slight change of a paradigm here on how organizations are led, and what are the leaders that are listening to us as well today can do, or can start to think about and reflect upon in terms of how to facilitate, stimulate, or create an environment that will be somehow nurturing in the sense of allowing those moments of compassion and self-compassion for their own stuff as well. Is there anything that you would like to say about that and the role of leadership in this?
Yes, I mean, I have written quite a lot about compassionate leadership. Yes. So, I mean, compassionate leadership really is interdependent with the culture, and they're synergistic. So you need to have compassionate leadership, really at all levels. That's one of the problems with the NHS. It's too hierarchical. But so just thinking, well, how do you create a compassionate culture? And that's where leadership is so important, because it's continuously reinforcing, and it's an inspiring but realistic vision, values. Promoting staff health and well-being, really ensure not just, as somebody said, I don't need Zumba classes, I need I need I need, I need to be able to sleep. I need to have IT that works. They're all these just practical things. Um, Listening to staff, encouraging participation, engagement is absolutely crucial in all things, and also with patients as well. So listening, problem solving, innovation, all levels, taking supportive and effective action when things are then when they're problems. And actually teamwork is really important, encouraging, compassionate teams, developing and modeling them. Supervision, mentoring is important. Again, that's part of the fabric of support, and making sure that staff feel safe, supported, respected, and valued. Because that's been one of the things post-COVID is a lot of people have not felt valued. They've had all these criticisms addressed to them. And one of the things which I think was very wrong was to say the NHS is broken. That is a thoroughly demoralizing, and it's a deficit-based approach rather than saying you've gone through a really difficult time, well done, and actually there's some really good things going on in there. How can we develop and expand those? So that would be a key thing, and nurturing those core values, as you said, of compassion, patient dignity, safety, and good leadership. And Amy Edmondson's written about the psychologically safe environment. That's very important, that people can speak up, clobbered, when they say that this isn't working well, or this isn't, or even I made a mistake, please can I, there needs to be that culture, which rather than the blaming culture. So there are many things, but I think a key thing, and I've written about this, is that we need a paradigm shift, as you mentioned, from an organization seen as a machine, which is called Taylorism, really going back to the engineer Taylor in the 1912. He wrote this paper on the scientific management of organizations, which was very much seeing individuals as cogs in a machine, and the emphasis efficiency and targets rather than on flourishing. And so you have to move from the organization as a machine to the organization as a human living adaptive system, and having self-organizing teams rather than this top-down, very rigid, hierarchical. So there's a lot behind all this, but that for me is the paradigm shift we need. There's too much emphasis on targets, on structures, on bureaucratic outcomes, and humanity versus bureaucracy is what.
Yes, versus KPIs.
Yeah.
And that's the thing. This notion that the change of paradigm for me sounds very horizontal, moving from a hierarchy to a more horizontal way of thinking, relating, and including bringing that element of cooperation and connection within teams as well, for people to know. And we know how important teams are. We have talked with other experts in this podcast as well, about the importance of the teams and how teams can be the force for good, or also can be the force for very difficult things. And so that cohesion within the team is so important, and that collaboration and the support of each other, the understanding as well. I personally think, and this is one of the things that I always bring up in the podcast, is about the importance of those reflective spaces. The whatever they are, the charts groups, the reflective practice groups, those spaces that will give, first of all, that relief and understanding that you are not alone with the difficulties that you may be experiencing, and that is 100%, more than 100% probably natural to experience pain, sadness, concern, all sorts of emotions related to the work that you are seeing, because you're working with pain and the suffering of others. I think the importance of understanding that against that hyper super critical self, that gives a buffer, that gives the understanding that we don't need to be there, but we need to be in the understanding of oneself, and our needs can probably help that self-compassion that we have
Yes.
been talking about. Do you
Yeah.
want to? Yeah, sorry.
Now, I was just going to say that was one of the good things in the pandemic was that there was actually more team cohesion quite often, and they actually embedded in what, huddles at the end of the day, a kind of group debrief. And of course, that was exactly what you said was really helpful. But again, that should become normalized in post-COVID.
Yes.
As you say, there's so much evidence that these reflective groups and team debriefs together are so helpful. Yeah.
Definitely.
Yeah.
Can you give us then some ideas? Because we are getting into the place of the episode where we want to think about something practical. We have thought about the organizations, the individuals. We know that this responsibility should not fall only on the individuals in terms of self-care,
definitely.
right? But do you want to share with us some activities or something that people can do or can start to do? Little steps maybe that they can put in practice to exercise self-compassion?
Oh, I see. Yes. Yes. Well, I think everyone has to find what works for them. So
Yes, agree.
So some people find, very energetic exercise helps them, going for a run every day. Because I'm just thinking of the people I've done. We've kind of worked, we work a kind of little program of what works for them. Some people, I mean, I personally find having a regular mindfulness practice helps you, but these are sort of for personal things.
Yes.
The journaling can help, writing down, but connecting with others is really important. And certainly all the evidence showed that people who did better were those who had some kind of, who had a lot of social support, or at least enough social support, and also had some kind of spiritual practice, whatever that might be. And also, they had self-care. They made sure that they ate enough. They made sure they slept enough. They made sure they did some exercise, just these things. But they're numerous. There's like a portfolio, if you like, of self-care strategies. Yes. I think the important thing is that they become habitual so that that they're regular and sustainable. They're not things that, I'd love to do X and you can't. Interacting with nature, just going, I mean, for example, I go out when I wake up in the morning, I have a little bit of Tai Chi or yoga, but then I go out into the garden, just walk around the garden because to just feel, rather than
feel the day
straight away in front of my computer. So, but, that's, as I said, I think that it's individual. And then we've talked about the need for that thing of togetherness. And I talked about moral resilience, which is something that somebody called Rushton brought. But it actually, collective moral resilience is something that's so important. And it's the same with moral injury. Moral repair, again, needs to be a collective enterprise. Yes. So that people can, together can deal with, system change and so on. And this is sort of digressing a little bit, but another thing which I find is really, I've mentioned Schwartzround, I've mentioned Refletics, which again is another thing, but also appreciative inquiry is something that I have been involved in and found is really helpful.
Can you tell us about it?
Yeah, I mean, it's kind of, it's almost countercultural because it's saying, as I said, it's not what's broken, what's going well. And it takes an asset-based approach, a strength-based approach. And instead of the sort of top-down change, it's inside out. So you can have groups, again, this can be a group thing. And it brings hope and energy into the system. And it's done by sharing stories, by imagining how things could be different. And then really setting plans. So it's got these 4 Ds. One is discovery. So, you think, what is it? And I've done this several times now with groups, is what is it that gives joy and meaning and purpose in your work? Give examples and you share these stories. And then you have the dream. So you've gone from discovery and you think, oh yeah, this is, and then dream, and then what could it be? What would be different? You walk into your place of work, what has changed? So you really start really imagining how things could be different, and that you do as a collective. Once you've done it individually, and then you start planning actions and choices. And then destiny is the last one. So you actually get a bit more concrete, you form action groups and plans. And then it's iterative. You keep, you celebrate the things that have gone well, and you keep seeing how can we refine this? How can we change this? So it needs to be done on a regular basis with the group. But there is quite a lot of evidence that it works in many different settings. And it always makes people feel much more energized and hopeful.
Yes, because absolutely encourages that sense of agency, right?
Yeah.
Because it's so easy when we are focusing on all the negatives that we feel defeated. Yeah. That's a natural response as well. But when we make the conscious effort, and it's the same with safety, is the same with, that inner sense of safety within, that when we feel secure, it's the look for all of those things that are working well. They're going well, and to make and expand them and make them bigger and better. And focus on and start from, as you said, that a strength approach is much and empowering, I will say.
And you can do it to yourself.
Yes.
I mean, definitely. Because once I find if I'm feeling rather depleted, and I suggest this to my clients, that you do what I call the positive data log, or the positive diary, that you write down 3 good things that have happened in the day. So it depends. You may be things you're grateful for, or maybe if you're feeling you're underachieving, things that actually small successes, or things that just made you feel joyful, and you write them down in whatever format you like, and then you have a look at it at the end of the week, and that can shift things.
Yes.
You realize not everything is so bleak. And there's evidence that sort of positivity, if you like, can be sustained for up to 6 months. So just doing it for 1 week. So,
wow. It's super powerful.
Yeah. So,
right. That is a very good idea for people to take with them and probably put it on to practice this week.
Yes.
That will be amazing. I'll do it myself. I think it's very encouraging, and it really, when we create these shifts in our own ways of seeing our own life as well, things start to happen in our surroundings and in life in general. We need to get to an end of this episode, but I don't want to end the episode without reminding everybody that this episode is part of Podcasthon, that we are asking for everyone that is listening to support and donate for Human Values in Healthcare Forum. You have heard all the marvelous things that you are doing with more money. Obviously, is easier to create more activities that normally, as you said, are for free for healthcare professionals. And so, but there are a lot of material as well that people can access already on the website. If you are listening this podcast, this episode, and you are interested in the things that we have been talking about, go to the website of the Human Values in Healthcare Forum and inform yourself as well. There are many things that can be useful for yourself and your team. Is there anything that you would like to say for us to close this episode, Paquita?
Well, one thing is to mention that we'll be having what I call our replenishing day, the 27th September, in a beautiful retreat center called the Royal Foundation St. Catherine, which is in London. And then we're going to be people who have done things differently, successfully, are going to be showing their thing, and we'll have an appreciative inquiry interactive part, but it's just a joyful time, and people can connect with each other. And we've had 2 so far, and they were very highly evaluated, sort of 9+ out of 10. So that's one thing. Great. And the other thing is just to remind ourselves that compassion is a positive emotion. And so it actually makes you feel better. So, and expands your horizons. So it's not, it's compassion fatigue is actually a misnomer. It's empathic distress fatigue. I just like to say this because people sometimes think, oh, it's something I only can have a certain amount. But actually, the more you can experience it, the more you can give it. So
Fantastic. Thank you for that clarification. It's so important because all of this terminology, have an intention sometime and is so used and well used, broadly used, and not everybody knows what are we actually talking about with these terms and so that's what we want to bring, clarification and clarity for people to further understand how much we are talking about here and how much there is there to do. That is not all lost. That there is a possibility to actually carry on and making things better. I want to thank you again, Paquita. Thank you so very much.
So thank you, Roxana.
Thank
it was
you
a pleasure.
To the Human Values in Healthcare Forum as well for all the work that you're doing. Don't forget to share this episode if you are listening and you found something that you really like and enjoy. Share it with your colleagues, with your managers, with your friends, your family, and let's spread the word. And yes, let's encourage everybody as well to donate for the Healthcare Forum and
join our newsletter.
And that's a very good idea. So you can keep up with what the work and the activities.
There's one is about to come out. Yeah.
Fantastic. Thank you so very much, Paquita.
Thank you, Roxana. Thank you.